So, if you think about the golden rule of startups, especially, out in Silicon Valley, it's always been that classic motto, right? Move fast and break things.
Right, yeah. Mark Zuckerberg's old favorite.
Exactly. And the whole idea is you just get your minimum viable product out the door today. You acquire your users, whatever the cost is, you get that revenue flowing, and then you just fix all those inevitable bugs tomorrow.
Which, I mean, it makes sense if you're building a social app, right? Speed is the ultimate metric of success in that world.
Yeah. But what happens when the thing your startup might break isn't just like an app interface or a shopping cart? What if the thing you break is an 80-year-old's access to life-saving dialysis?
Oof. Yeah, the stakes completely change.
Right. Like what happens when a software bug leaves a really vulnerable patient just, stranded on a freezing curb? So for today's deep dive, we are looking at a company that is intentionally refusing to launch.
Which is wild to think about.
It is. They are literally taking that entire modern startup playbook, throwing it straight in the trash, and choosing this path of deliberate, painstakingly slow foundation building.
And honestly, that refusal to rush is probably the most fascinating business strategy we've seen in this space in a long time.
Oh, for sure.
Because, we're also conditioned to look for immediate traction, like user growth, monthly recurring revenue, daily active users.
Got to have those metrics for the investors, right?
Frankly. But the scenario we are diving into today, it really demonstrates how withholding a service until the infrastructure is absolutely bulletproof, well, it isn't a failure to launch.
Right.
In these highly regulated, high-stakes industries, it's actually the ultimate competitive advantage. I mean, it builds this moat of trust that a rushed competitor simply cannot replicate.
Yeah, and the company putting this exact theory to the test is called SwiftAid Transport. And just for context, today is Wednesday, June 10th, 2026. And in exactly 3 days, on June 13th, 2026, SwiftAid Transport is going to celebrate its one-year anniversary. They were officially formed on June 13th, 2025.
Right, so a full year.
A full year. And you would think, a one-year anniversary would involve celebrating a certain number of customers served or some big revenue milestones they hit.
Right, the usual startup press release.
Exactly. Yet 1 year later, they are still not accepting a single ride request.
Not one.
Not one. They are building a non-emergency medical transportation company, which is widely known as NEMT, and they have spent an entire 365 days purely laying the foundation.
Which is a massive financial commitment when you have zero revenue coming in.
Absolutely. So we actually have their year-in review document right in front of us. And the mission for our deep dive today is to really unpack the hidden complexities of this NEMT industry.
But it is complex, believe me.
We're going to explore the mechanics of this space, right?
Yeah.
And really dig into why this counter-narrative to the rush-to-market culture is, frankly, the only responsible way to operate here.
Yeah, and to really grasp the weight of their strategy, we have to establish what NEMT actually is. Because, honestly, the public largely misunderstands it.
Oh, completely.
Because NEMT doesn't use, sirens or flashing lights like a 911 ambulance. People tend to just lump it in with taxis or rideshare apps.
Yeah.
Like it's just an Uber for old people.
Right, which is so far from the truth.
It is a highly specialized, critical piece of healthcare infrastructure. I mean, it operates in this massive gray area between an emergency room run and just a casual drive to the store.
So give us an example. What kind of trips are we talking about?
Well, we are talking about transporting patients to chemotherapy or bringing a senior citizen who relies on a really heavy motorized wheelchair to a cardiology appointment.
Okay.
Or even moving a patient from a hospital to a specialized rehab facility after like a complex spinal surgery. So the stakes are profoundly medical, even if the vehicle itself isn't, running a red light to get there.
Right, which ties perfectly into this document. SwiftAid's year-in review explicitly states their core philosophy, right from day one, is people over profit.
Right.
Now, on its face, that just sounds like standard corporate PR phrasing, right? I mean, every company claims they put people first.
Sure, it's a great bumper sticker.
Yeah, exactly. But SwiftAid argues that medical transportation isn't just a peripheral service. It is a fundamental integrated part of the patient's actual care experience.
Because it is.
And they outline this brutal domino effect that happens when just one single element goes wrong in NEMT.
Yeah, they break down 4 very specific scenarios in the document that really illustrate the fragility of this whole ecosystem. Let's look at the first one. A missed ride equals a missed appointment.
Okay.
Now, in a standard commercial context, missing an appointment is just an inconvenience. You reschedule a haircut for next Tuesday, no big deal.
Right, you just call and apologize.
Exactly. But let's apply this to the specialized medical context.
Yeah.
Say you are a patient dealing with a complex, undiagnosed neurological issue. You might have waited 6 entire months to get a 50-minute consultation with a top-tier neurologist.
Mhm.
If your NEMT van simply doesn't show up, you don't just get bumped to tomorrow.
Oh, wow.
You get bumped to the back of a 3-month waiting list. So that missed ride directly impacts the biological trajectory of a disease.
That is terrifying.
Right. It delays diagnosis, it delays intervention, and it fundamentally alters the patient's long-term health outcome.
See, that completely reframes the entire service for me. It's not a transportation failure at that point. It's a literal medical setback.
Exactly.
And then the second scenario they bring up, it focuses on the collateral damage to the caregivers.
Yes.
They say poor communication creates massive psychological stress for the people managing the patient's life.
Because the caregivers are already spread so thin.
Right. Just picture this, right? A daughter who has taken a highly coveted, probably unpaid day off from work just to get her elderly mother, who, let's say, suffers from advanced dementia, to a critical appointment.
Oh, that's such a tough situation.
It is. They are standing on the curb. The mother is confused. She's getting agitated. It's 30 degrees outside.
Yeah.
The ride is 30 minutes late, and there is zero communication from the transport company. No tracking link, no phone call, literally nothing.
And the psychological toll of that uncertainty is just immense.
Exactly. You're standing there wondering if you need to drag your mother back inside, wondering if you'll lose your job because you have to take another day off next week.
Well, and the caregiver is frequently the invisible stakeholder in healthcare. They absorb all the friction of a broken system.
That's a great way to put it.
When an EMT company fails to communicate, they are essentially offloading their own operational incompetence onto a family member who is already at their breaking point.
Wow. Yeah, that really paints a picture. And then the third scenario SwiftAid highlights, it shifts the focus to the institutional level, right? To the
Yeah.
healthcare facility itself. They note that a late discharge pickup disrupts an entire hospital team. Now, to understand the gravity of this, we really have to look at the mechanics of hospital bed management, specifically this thing called ED boarding.
Yes. This is a massive issue.
So let's break that down for everyone, because I think most of us only ever see a hospital from the waiting room. How does one late van impact an entire building?
Okay, so hospitals operate on razor-thin bed turnover margins. Every single bed is a finite, highly critical resource.
Okay.
Let's say a patient on the telemetry floor is medically cleared to go home, or maybe to a nursing facility, at 11:00 a.m.
Right.
The hospital needs that bed cleaned and prepped for the next patient. But if the EMT transportation doesn't arrive until 4:00 p.m., that discharged patient is occupying a fully staffed, monitored bed for 5 unnecessary hours.
Oh, wow. I didn't even think about that.
Right. And meanwhile, down in the emergency department, the ED, you have a patient who came in with a heart attack. They've been stabilized, but they desperately need to be admitted to that exact telemetry bed upstairs.
But they can't be moved because the other patient is still there waiting for their ride.
Exactly. So they are boarded in the ED hallway.
Which means the ED bed they are occupying down there can't be given to the new patient just walking through the sliding doors clutching their chest.
Yes. And if the ED fills up completely because patients can't move upstairs, the hospital has to go on diversion status.
Wait, what does that mean? Diversion status?
It means they literally radio incoming ambulances and tell them to go to a different hospital miles away.
Are you serious?
Totally serious. One unreliable transportation company failing to pick up a patient at 11:00 a.m. can literally result in an ambulance being turned away from an emergency room at 2:00 p.m.
That is insane.
The ripple effect is staggering. And by the way, it costs hospitals millions of dollars in inefficient resource allocation every year.
Okay, well, that completely justifies why a hospital discharge planner would be incredibly aggressive about only working with reliable vendors.
Oh, absolutely. They have zero tolerance for it.
And the fourth scenario they mention brings it right back to the physical experience of the patient. They say a rushed driver makes a vulnerable passenger feel unsafe or overlooked.
Yeah, and this goes right back to the business model.
Right. If a company's model relies on packing as many trips into a day as possible just to maximize their profit margins, the driver inevitably falls behind schedule.
Because things always take longer than you think, especially when you're moving people with mobility issues.
Exactly. So the driver starts taking corners a little too fast, they're braking harshly, or they're rushing the passenger during the boarding
Wow,
process.
so dangerous.
Yeah. I mean, if you are a patient recovering from invasive spinal surgery, a harsh brake at a stoplight isn't just uncomfortable, it induces agonizing physical pain and, honestly, emotional terror.
It completely violates the core premise of medical care, which is, do no harm.
Right.
When SwiftAid says people over profit, they're codifying this exact standard. It doesn't mean they operate as a charity or they just ignore the balance sheet.
Right. They still have to run a business.
Exactly. But it means the revenue model must be subservient to the safety of the people it serves. Safety must dictate the schedule, rather than the schedule dictating safety.
Okay, wait. I'm putting myself in the shoes of that stressed caregiver on the curb right now.
Sure.
If the absolute goal is helping people, isn't keeping the community waiting for your service technically leaving them stranded? I mean, SwiftAid is refusing to take calls right now.
Yeah.
Why is withholding the service entirely until it is 100% perfect better than offering good enough service today? If they put just a few vans on the road right now, couldn't they be alleviating some of that hospital backlog you just described?
That is a great point. And honestly, the tension you are highlighting is the defining struggle of their entire first year.
I can imagine.
SwiftAid's argument is that in the context of healthcare infrastructure, good enough is actively dangerous.
Interesting.
Introducing a flawed, unprepared, or even partially baked service into a fragile ecosystem, it doesn't solve the problem. It compounds unpredictable risk.
So it's worse than having no ride at all.
Exactly, because predictability is the currency of healthcare. If a dialysis clinic knows a patient definitely does not have a ride, the clinic can proactively manage that reality.
Okay, right. They can figure out a plan B.
Right, they can contact a social worker, arrange alternative emergency care, or adjust their clinical schedule.
But if they're relying on an NEMT provider who promises to be there, and then that provider fails to show up, the clinic completely loses the window to intervene.
Yes, a bad ride or an unreliable commitment, it strips the patient and the provider of their agency.
Wow.
Furthermore, just from a pure business survival standpoint, launching early and missing a critical pickup permanently torches your reputation.
Oh, I bet. Word probably travels fast.
Very fast. A hospital discharge planner will forgive a company that says, hey, we aren't launching until next quarter to ensure our fleet is ready. They will never forgive a company that says, we can do it, and then leaves their patients stranded in the lobby for 6 hours.
Yeah, you don't come back from that.
You really don't. SwiftAid is operating on the principle that introducing an unreliable variable into a patient's care plan is a fundamental violation of trust. And trust, once it's broken in healthcare, is almost impossible to rebuild.
That framework totally explains their approach to what they call a responsible launch. The year in review document mentions that the public, and probably local healthcare facilities too, are constantly asking them, are you available now?
Constantly.
And SwiftAid's internal response to that pressure is just a simple question. They ask themselves, are we ready to serve people the right way? They explicitly state they are choosing to launch with standards, not excuses.
And setting a standard requires navigating just an avalanche of invisible preparation.
Invisible is the key word there.
It is. Because when the public sees an NEMT van driving down the street, all they see is a vehicle. What they do not see is the operational blueprint required to keep that vehicle legally and safely on the road.
Right.
They don't see the specialized commercial liability insurance policies, which, by the way, are astronomically expensive and complex.
Oh, I'm sure.
They don't see the staffing models, the background check protocols, the drug testing compliance, or the stringent state and federal regulatory hurdles.
Well, speaking of the vehicles, the document notes that vehicle acquisition is their next major milestone. And they emphasize that it's focusing heavily on passenger needs, safety, accessibility, and cleanliness.
Right.
So it's clearly not just about driving down to a local dealership and buying a fleet of standard minivans.
Far from it. Outfitting a proper NEMT vehicle, especially one meant for ADA, that's the Americans with Disabilities Act compliance, is basically an exercise in specialized engineering.
Really? How so?
When we talk about an ADA-compliant wheelchair van, we're talking about a vehicle chassis that has been heavily modified. The floor is often literally lowered.
Lowered, why?
To provide the federally mandated interior headroom, so a passenger sitting in a tall motorized chair doesn't hit their head on the roof of the van.
Oh, wow. I wouldn't have even thought of that.
And the suspension has to be reinforced to handle the asymmetrical weight of a heavy hydraulic lift mechanism on one side of the vehicle.
So it's a massive retrofitting job.
Exactly.
Honestly, building SwiftAid feels a lot like building a new hospital wing.
That's a great analogy.
Right. You wouldn't cut the ribbon, unlock the doors, and start admitting highly infectious patients just because there's a line out the door if the HVAC filtration system and the surgical sterilization equipment haven't been installed and tested yet.
Right, you just wouldn't do it.
You'd have to look at the sick people in line and say, look, I know you need help, but if I bring you in here right now, I might give you a secondary infection. The delay is a necessary form of protection.
Exactly. And the infection in the NEMT world is an avoidable problem. And SwiftAid uses that exact phrase in their review, avoidable problems.
Yeah, I saw that.
In consumer tech, an avoidable problem might mean a user's app crashes during checkout, which results in, an angry customer service email.
Right.
In NEMT, an avoidable problem means a mechanical failure on a hydraulic ramp while a patient is suspended 3 feet in the air.
Oh my God.
Or it means a HIPAA privacy violation because patient data wasn't encrypted. These scenarios don't just result in a bad Yelp review. They result in devastating physical injury to a human being, federal investigations, and the total loss of a company's operating license.
Wow. Okay, so their document states, building responsibly is slower, but it is stronger. So let's actually look at what that strength translates to operationally.
Sure.
Because if manual paperwork and ad hoc communication are what lead to the chaos of a stranded patient, how does a startup physically prevent those errors from happening at scale?
That is the million-dollar question.
And this brings us to their digital infrastructure.
Yeah.
And honestly, looking at this, the sheer scale of what they are building before serving a single passenger is intense.
It really is. The tech stack is where we see the people over profit philosophy translated into actual binary code.
Right.
SwiftAid is implementing a massive internal ecosystem. They're utilizing the Zoho software suite. So Zoho One, the Zoho CRM for customer relationship management, Zoho Desk for ticketing and support, Zoho Recruit for hiring, Zoho Projects for internal tracking, Zoho Mail, and they are linking all of this with digital documentation workflows and GPS-integrated dispatch planning.
Wait. You are telling me they're spending an entire year setting up an enterprise-level software ecosystem for a fleet of 0 vehicles?
Yep.
That sounds like a massive misallocation of startup capital and time. I mean, why not just buy the vans, use a basic Excel spreadsheet and a couple of iPhones to manage the first 100 rides, get some cash flow, and then upgrade the software later?
Because relying on spreadsheets and text messages in the medical transportation industry is precisely how catastrophic errors and systemic fraud occur.
Fraud.
Yes. Technology in NEMT isn't about looking sophisticated for investors. It is entirely about structured, immutable data.
Okay, unpack that for me.
Let's look at the anti-fraud aspect, which SwiftAid explicitly highlights as a primary focus from day one. Historically, the NEMT industry, particularly the segment funded by Medicaid, has been absolutely plagued by bad actors exploiting chaotic, paper-based billing systems.
Really? How does that fraud actually work in practice?
It usually takes the form of phantom trips or upcoding.
Okay, what's a phantom trip?
A phantom trip is when a dishonest company bills Medicaid for a ride that never actually took place.
Wait, how did they get away with that?
Because the documentation relies on a driver's handwritten log sheet that just gets signed by a busy nurse who isn't really paying attention. It's incredibly easy to fake.
Wow. And what's upcoding?
Upcoding is when a company transports a patient who can walk perfectly fine. They put them in a standard sedan, but then they bill the state as if they provided a highly specialized, much more expensive stretcher transport.
Oh, so they are just bleeding taxpayer dollars by exploiting a lack of real-time oversight.
Exactly. And the consequences of an audit are fatal to a business if they get caught. When SwiftAid integrates GPS dispatch planning and digital documentation workflows through Zoho from the very beginning, they are creating an unalterable digital ledger.
Ah!
Let's trace the data flow just as an example.
Yeah, walk me through it.
A hospital discharge planner logs into a portal and requests a ride. That request hits Zoho Desk, creating a support ticket.
Okay.
The ticket flows into Zoho CRM, linking to the specific patient's profile, which flags that they require a wheelchair lift.
So no one has to remember to ask for it.
Right. Then the dispatch system reads that data, locates the nearest properly equipped van via GPS, and sends the road directly to the driver's tablet.
And the software tracks the physical reality of the trip.
Yes. It logs the exact timestamp the driver arrived at the pickup location. It tracks the exact GPS route taken, ensuring the driver didn't take an unnecessarily long route to inflate the mileage.
Oh, that's smart.
And it logs the exact timestamp of the drop-off. This closed-loop system protects the patient from being forgotten. It protects the state funding the ride from financial exploitation, and it protects SwiftAid from compliance audits.
So for a healthcare facility to trust a new vendor, SwiftAid has to be able to provide immediate, documented proof of everything.
Everything.
Like if a social worker calls and says, hey, did my patient make it to their dialysis center yesterday? They aren't answering their phone.
Right.
SwiftAid shouldn't have to radio a driver and ask them to rely on their memory of a Tuesday afternoon. They can instantly pull up the CRM, look at the digital file, verify the GPS coordinates of the drop-off, and send an automated, time-stamped report to the social worker.
Exactly.
So the tech stack isn't overkill at all. It's literally the mechanism that proves they are a legitimate healthcare partner.
Structured data builds trust. And it ensures that, as SwiftAid states, no one is left in the dark. But there's a crucial caveat here.
What's that?
The year-end review explicitly notes that while technology can organize the schedule and track the data and prevent the fraud, AI and digital tools cannot replace human compassion.
Oh, absolutely.
You can have the most advanced routing algorithm in the world, but software cannot physically secure a wheelchair. And software cannot reassure a terrified patient.
Right.
The human element, the actual face of the company, is the driver.
Yeah, they place an immense amount of weight on the role of the driver in this document. They state clearly that drivers are not, quote-unquote, just drivers. They are the first and last face of the passenger's care experience for that day.
And when you really think about it, it's true.
When you look at who is actually sitting in the passenger seat, the gravity of the role just becomes obvious. These are not people hopping in a rideshare to go to a nice restaurant.
No.
Passengers may move with extreme difficulty. They might be highly anxious about a pending diagnosis. They might be in acute pain, recovering from invasive surgery, or requiring, recurring physically exhausting treatments.
So consider the psychological profile required for a professional NEMT driver. It is vastly different from someone delivering packages or driving for a standard consumer app.
It has to be.
An NEMT driver is navigating human vulnerability. If you arrive at a home to pick up a senior citizen who has just started chemotherapy, their energy levels are totally depleted.
Right.
Your patience, when it takes them 7 full minutes just to walk from their front door to the passenger seat, dictates the tone of their entire medical experience that day. A sigh of frustration from the driver or a rush to get them moving faster, it just strips that patient of their dignity.
The document lays out an extensive list of standards they are building for their drivers. It includes passenger dignity, wheelchair securement, high PA privacy awareness, defensive driving, emergency awareness, and care-centered professionalism.
It's quite a list.
It is. And if you look at the training required here, the driver functions much more like a medical assistant on wheels rather than a chauffeur.
And the physical and legal mechanics of those standards are incredibly rigorous. Let's examine wheelchair securement for a second.
Sure.
The general public often assumes you just roll a wheelchair into a van and click a standard seatbelt over the person.
Yeah, I think that's what I pictured.
But securing a wheelchair in a moving commercial vehicle is a highly technical process involving physics and structural engineering.
Really?
It typically requires a specialized 4-point tie-down system, often using L-tracks, that are mounted directly into the reinforced floor of the van.
Oh, wow.
And the driver must understand the structural integrity of different types of chairs. They have to know exactly where to attach the retractors so that the sheer force of a sudden stop doesn't snap the frame of the wheelchair.
That is so specific.
Furthermore, the occupant must be secured with an independent lap and shoulder belt anchored to the vehicle, not just the chair's built-in positioning belt. If a driver cuts a corner and only uses 3 tie-downs instead of 4, a single sharp turn at 30 miles per hour could be fatal.
That's terrifying. So the physical safety is paramount, but the legal and privacy standards are just as strict, right? They highlight HIPAA privacy awareness. What does a HIPAA violation actually look like in the context of driving a van?
Well, a driver inherently holds protected health information, which is fiercely guarded by federal law. The driver knows the patient's full name, their home address, and critically, their medical destination.
Right, where they are going tells you a lot.
Exactly. If a driver transports a patient to an oncology ward, a psychiatric facility, or a methadone clinic, that driver is in possession of deeply sensitive data regarding that individual's medical condition.
Absolutely.
A HIPAA violation in transit could be as simple as the driver stopping at a local diner after their shift and casually mentioning to the bartender, "Yeah, I just drove John Doe from Elm Street over to the infectious disease clinic."
just innocent gossip.
But that breach of confidentiality carries massive financial penalties and can literally destroy the patient's life.
SwiftAid clearly recognizes that you cannot train that level of physical precision and legal discretion into someone over a weekend.
No, you can't.
You can't just hire someone off a local job board on Monday, hand them the keys to a $70,000 modified medical vehicle, and hope they understand federal privacy laws by Tuesday.
It's impossible.
And that is exactly why they are spending a year on quote-unquote driver training preparation before they even post a job listing. They are building the curriculum pathways in Zoho Recruit to ensure that every person who eventually wears a SwiftAid uniform understands that they are safeguarding human life.
But having perfectly trained drivers and cutting-edge software solves only the internal operational challenges. The final frontier their foundation building actually addresses the external environment. SwiftAid realized that having the best infrastructure in the world is completely useless if the public doesn't even know how to access, categorize, or pay for the services they need.
Which leads us to the education gap. The year in review points out a fundamental truth about this industry. People generally do not understand NEMT until the exact moment their world falls apart and they desperately need it.
Right, you don't research medical transportation options on a Sunday afternoon for fun.
Exactly. You learn about NEMT when your father suffers a severe stroke, is suddenly bound to a wheelchair, and can no longer fit in the passenger seat of your Honda Civic.
Yes.
In that moment of crisis, families are just thrust into this labyrinth of healthcare terminology.
And to combat this, SwiftAid decided to function as an educational platform. They are building out a website, publishing detailed blogs, planning a YouTube channel, developing podcast content, and creating an NEMT Answers Center.
So they are essentially taking on the burden of decrypting the healthcare maze for the general public.
They are. And the topics they are covering are incredibly dense. They are educating the public on the difference between ambulatory transportation, ADA, wheelchair transportation, and stretcher transport.
No.
They discuss the critical differences between Medicaid and Medicare coverage. They explain private pay options. And they break down the specific mechanics of medical answering services, or MAS, in New York State.
If you are managing care for a parent, these terms just blur together.
Oh, completely.
What actually is the difference between Medicare and Medicaid in this context, and why does it cause so much heartbreak?
Oh, it is the single largest point of confusion in elderly care. Let's look at the historical and functional difference. Medicaid, which was established under Title IX of the Social Security Act, is a joint federal and state program primarily designed for low-income individuals.
Okay, got it.
Crucially, Medicaid policy recognizes that medical care is totally useless if the patient cannot physically get to the facility. Therefore, Medicaid generally does cover non-emergency medical transportation as a mandatory benefit.
Oh, okay, so it's built in.
Yes, if you are on Medicaid and need a ride to an approved medical appointment, the state provides a mechanism to fund that transportation.
And
Medicare, established under Title VIII, is a federal program primarily for people over the age of 65, regardless of income. Standard Medicare is focused strictly on clinical care doctors, hospitals, medications.
So no rides.
It typically does not cover routine NEMT. It will pay for an ambulance if you are actively having a heart attack and need emergency transport to the ER. But Standard Medicare Part B will not pay for a specialized wheelchair van to take you to a routine physical or a scheduled dialysis appointment.
Wait, really? Not at all.
Unless you have opted into specific, often costly, supplemental Medicare Advantage plans that happen to offer a transportation benefit.
Oh, wow. So you have a scenario where a family thinks, okay, grandma's 75, she has Medicare, her health care is entirely covered.
Right.
They call a private NEMT company, book a specialized wheelchair van equipped with a hydraulic lift, the ride happens, and then the family receives a bill for hundreds of dollars that they absolutely cannot afford because Medicare denies the claim.
And by the time the financial reality sets in, the family is in debt, and grandma is terrified to book another ride, meaning she starts skipping her appointments.
That is heartbreaking.
It really is.
Yeah.
So SwiftAid is tackling this informational void head-on. They're also defining the vehicle classes so families know what to ask for.
Right.
Ambulatory transport means the patient can walk, perhaps with the assistance of a cane or a walker, and can physically pivot and transfer into the seat of a standard sedan or SUV.
But if they can't pivot, they need an ADA wheelchair vehicle.
Yes. If the patient must remain in their chair during the journey, they require an ADA-compliant vehicle with a hydraulic lift or a reinforced ramp, and the heavy-duty securement systems we discussed earlier.
Right? The L-tracks.
Exactly. And if the patient is entirely bedbound and cannot sit upright, they require stretcher transport, which demands a highly specialized vehicle and often two trained personnel to safely transfer the patient from their bed to the stretcher.
So if a family doesn't know these terms, they might call a provider in a panic, ask for a quote-unquote medical ride, and a standard sedan arrives for a patient who is completely bedbound.
And then the ride has to be canceled, the appointment is missed, and the domino effect begins again.
They also specifically mention educating the market on MAS medical answering services in New York. How does that factor into the logistics?
Well, New York State utilizes a brokerage model to manage its Medicaid transportation. MAS is the broker. A patient or a facility cannot just call up a local NEMT company directly, ask for a ride, and tell them to send the bill to Medicaid.
They can't.
Nope. The request must go through the MAS portal or call center. MAS verifies the patient's Medicaid eligibility, confirms the medical necessity of the trip, and then assigns the trip to an approved transportation provider in their network.
That sounds like a lot of red tape.
It is. If a hospital social worker or a family member doesn't know how to navigate the MAS system to get the prior authorization, the ride doesn't happen and the provider doesn't get paid.
Okay, but from a business strategy perspective, taking on this level of public education is a massive undertaking. Why spend time and capital writing detailed blogs about Medicaid brokerage rules and producing videos about wheelchair lifts, rather than just running targeted Facebook ads promoting their future services?
I know, it seems counterintuitive.
Isn't it technically the government's job to explain Medicaid to the citizens?
In a theoretical world, yes, the government systems would be perfectly intuitive. But the reality is that government portals are opaque and, honestly, intimidating.
True.
From a strategic standpoint, an educated consumer base eliminates operational friction. If a discharged nurse at a busy facility or a son trying to manage his father's care knows exactly what terminology to use, exactly what their insurance will and will not cover, and exactly how many days in advance to request authorization through MAS,
then the dispatching process for SwiftAid becomes flawless. They are essentially training their future customer base on how to be the perfect client. If you teach the customer how to order exactly what they need, utilizing the correct terminology, the company never has to deal with the operational chaos of sending the wrong vehicle or dealing with denied insurance claims.
It streamlines the entire pipeline. Furthermore, SwiftAid explicitly states, public education is not separate from our mission. It is part of our mission.
I love that.
By establishing the NEMT Answers Center, they are positioning themselves as the ultimate local authority on the subject. When a social worker in Orange County encounters a highly complex transportation scenario, they aren't going to waste an hour digging through a state government website. They are going to reference SwiftAid's resources.
Right, and when that social worker inevitably needs to book a complex, high-stakes private pay ride, who are they going to trust with their patient?
The company that gave them the answers.
Exactly. Which transitions perfectly into the final major killer of their foundation, earning local trust. Educational content builds intellectual understanding, right? Reading a well-crafted blog post makes you smarter about Medicaid.
Sure.
But deep institutional trust requires physical presence. It requires localized integration. The Year in Review notes that SwiftAid is heavily focused on Orange County, New York. And they detail how they have been putting skin in the game within that specific geographic community long before their launch date.
Because community integration is the bedrock of a service-based business. You cannot, quote-unquote, disrupt local healthcare from a remote server in another state.
No, you really can't.
They highlight that they joined the Orange County Chamber of Commerce. The document also specifically recognizes Jamel Melholder's community involvement and leadership, emphasizing that he was showing up for the community before there was anything to gain.
That phrase, showing up before there is anything to gain, is the absolute antithesis of standard transactional networking.
Oh, 100%.
So often in the business world, founders only attend networking events or community meetings when they have a glossy business card to hand out and a software subscription to push.
Right. Everyone's always selling something.
But Jamel Holder and the SwiftAid team are out there shaking hands, volunteering, listening to local grievances, and building interpersonal relationships while their service is still entirely theoretical.
It proves their authenticity.
Yeah.
Healthcare is fundamentally local.
Yeah.
A hospital discharge planner working in Orange County has likely been burned in the past by anonymous tech platforms that parachuted into the market promising to revolutionize transportation with a slick app, only to vanish the moment liability issues arose or driver supply dried up.
Right. The app developers don't have to face the community when things go wrong.
Exactly. But that local discharge planner will trust Jamil Holder. They will trust a company that has submitted itself to the vetting process of their local Chamber of Commerce. Local business requires localized accountability. If you fail a patient in your own community, you have to look the patient's family in the eye at the grocery store.
That's a great point. They also took a step that requires an incredible amount of vulnerability. They launched a community fundraiser to help secure capital for vehicle acquisition, commercial insurance, the tech stack, and operational readiness.
It was bold.
Yeah, asking for money is inherently uncomfortable, but asking your neighbors to financially support a business that hasn't even launched yet and won't for several more months takes a profound level of nerve.
It does, but let's analyze the mechanics of crowdfunding in this specific context. What does skin in the game mean here?
Wow.
Yes, it provides necessary capital for things like commercial auto insurance, which is one of the highest barriers to entry in the NEMT space. But more importantly, a public fundraiser serves as a massive accountability mechanism.
How so?
When a local business owner or a community member donates $50 to the SwiftAid Launch Fund, they aren't just a donor providing capital, they transform into a stakeholder. They become emotionally invested in the success of the operation.
The document captures the sentiment perfectly. It says, support does not only come in the form of money. Sometimes support is a conversation. Sometimes it is a referral. Sometimes it is encouragement. Sometimes it is a community member saying, this is needed.
Yeah, that's powerful.
They aren't relying on theoretical market research surveys to prove demand. They are crowdsourcing validation through real, tangible human interaction.
And by being entirely transparent about their capital needs, publicly stating, hey, we need resources to ensure our vehicles are safe, our branding is clear, and our training is exhaustive. They are demystifying the entrepreneurial process for their neighbors.
They aren't pretending to have it all figured out.
Right. They aren't hiding behind a facade of being a fully funded, invincible corporate giant. They are presenting themselves as a dedicated local team, doing the grueling foundational work and inviting the community to help them build infrastructure that the neighborhood desperately requires. It turns the community from passive future consumers into active partners in the build.
Man, we have covered an immense amount of ground today. Navigating from the dangerous domino effects of a delayed hospital discharge to a complex mechanics of ADA vehicle outfitting, down into the digital ledger of the Zoho CRM, and through the regulatory maze of Medicaid and IPA.
It's a lot to process.
It really is. But when we step back and view this 365-day journey comprehensively, a profound pattern emerges. It starts with the realization that a responsible launch requires immense patience. An idea, no matter how noble, must be supported by rigid systems and digital accountability.
It also forces us to acknowledge that the transportation challenges faced by patients are intensely real. We're dealing with biological consequences, caregiver burnout, and systemic hospital delays.
Yeah.
SwiftAid recognized that the public desperately needs accessible answers to complex healthcare coverage questions, moving that education is a core operational necessity, not merely a marketing feature.
Exactly.
Furthermore, they demonstrated that in a high-stakes environment, community trust must be earned through physical presence and vulnerability long before the launch date.
And perhaps the most vital takeaway: technology must serve people, not replace human compassion. Enterprise software can eliminate fraud and optimize a dispatch route, but it cannot hold a terrified patient's hand or safeguard their dignity.
Beautifully said.
SwiftAid notes that their next immediate steps are acquiring those specialized ADA vehicles, finalizing their live dispatch testing, and continuing their rigorous outreach to local healthcare facilities.
The real work begins now.
For anyone listening who is based in Orange County, or anyone in the broader healthcare ecosystem who wants to follow this incredibly deliberate journey, they are actively looking to connect. You can reach out for future partnerships, ask questions, or just offer support by emailing them at support@swiftaidtransport.com or calling them directly at 973-315-6000.
It is a journey that challenges almost every assumption we have about the modern business life cycle. And that brings me to a final thought for you to mull over long after this deep dive ends.
Let's hear it.
SwiftAid sacrificed an entire year of potential revenue. They worked for 365 days without making a single dime, choosing instead to focus entirely on invisible infrastructure, legal compliance, digital ledgers, and community trust.
Right.
Take a hard look at your own industry, or even the personal projects you are currently building. In a culture that relentlessly demands instant gratification and rapid deployment, what catastrophic, avoidable problems could you prevent if you simply gave yourself the permission to build slowly? What would happen if you chose to launch with standards instead of excuses?
It fundamentally rethinks the rush. At the beginning of this deep dive, the idea of building a business for an entire year without taking a single customer sounded like a recipe for absolute disaster.
It did.
But after unpacking the murky, high-stakes waters of medical transportation, it becomes clear that refusing to rush might just be the most profound act of care a company can possibly offer. Thanks for diving in with us. We'll catch you next time.